Good afternoon, everyone. We welcome you all to another of our lectures under our cancer advocacy. On behalf of the Olongapo City Medical Society, I thank you once again for obliging us your Saturday afternoon to learn with us another important topic. Maraming salamat po sa inyong partisipasyon at pagpapaunlak sa aming muling imbitasyon. Ako po ay magpapakilalang muli, ang inyo pong lingkod, Dr. RJ Manzo ng OCMS, ang inyo pong host ngayong hapon. Let us now get the ball rolling with a short prayer, followed by the Philippine National Anthem, the Philippine Medical Association hymn, and lastly, the OCMS hymn.
Let us put ourselves in the presence of the Lord. Thank you, Heavenly Father, for gathering us once again in this activity. Thank you for blessing us with another day to live, to learn, and to love this life we have. We pray that we may use what we learned today to better care for ourselves and our loved ones. We pray for everyone present here today, that we may all live life to the fullest with purpose and good intention, and always with kindness for others. Keep us safe, keep us healthy, and keep us hopeful as we live each day for your greater glory. Amen.
Mga kababayan, ang pambansang awit ng Pilipinas.
Puso ko'y tinip ng kasayahan, dahil ako'y nasama sa tanan. Ang lahat may gintong nasa, makisig at masigla. Kapisanan ay tunay ang damdamin, suliranin itong baya'y pawiin. Idalangin natin ang tapat sa may kapal, ngayon sa lahat. Awit ng GMA, tayo ay mag-iwan. Magtulungan, magunlad ng bayan. Ang kailangan, ibigay sa kanan, kalusugan at kasaganaan. Ang puso ko'y tigib ng kasayahan, dahil ako'y nasama sa tanan. Ang lahat may gintong nasa, makisig at masigla. Kapisanan ay tunay Idalangin natin ang tapat sa may kapal, may lunas sa lahat. Idalangin natin ang tapat sa may kapal, may lunas sa lahat.
Namin sa may kapal, pagkamay niya ang pinagdarasal. Tungkulin namin ay ang maglingkod sa mga mamamayan ng aming lungsod. Kami ang mga manggagamot ng olong gabon. OCMS, karamdaman may lunas. OCMS, anuman ang dinaranas, lahat ay gagawin para sa pagaling. OCMS, patungo sa hinaharap. OCMS, kalusugan naming pangarap. Sinumpa ang tungkulin ay tutuparin. Kami ang OCMS.
Maraming salamat po.
Magandang hapon po muli. Hindi po matatapos ang aming pasasalamat sa patuloy ninyong pagsuporta sa aming year-long Cancer Awareness Advocacy. Naniniwala po kasi ang OCMS na mahalaga po ang edukasyon ng bawat isa sa atin upang matuto ukol sa cancer. Latest statistics have shown that cancer is still the second most common cause of death in people worldwide. Nangunguna pa din ang sakit sa puso at ito pong panahon ng pandemic, pumapangatlo ang COVID-related deaths. That is why we believe it is very important to raise awareness in our community on cancer. Itong hapon po ay ang aming pang-siyam na lecture sa series namin for this cancer advocacy. January is Liver Cancer Awareness Month. Sa atin pong bansa, dineklara po sa Republic Act 10526 na ang buwan ng Enero ng bawat taon ay Liver Cancer and Viral Hepatitis Awareness and Prevention Month. This year, the Department of Health celebrates January 2022 as Liver Cancer Awareness Month with the theme, Malusog na Atay, Masayang Buhay. Napakahalaga po itong araw na ito sapagkat ang ating bansa po ay sa kasalukuyan, ang liver cancer o cancer sa atay ang pang-apat na pinaka-common na cancer. Sa buong mundo naman po ay ito ang pang-anim na pinaka-common in incidence. Kaya po mahalagang ating pakinggang maigi ang usapin natin ngayong hapon. Hindi lang po tayo matututo ukol sa liver cancer, ngunit tayo din po ay mabibigyan ng mahalagang kaalaman tungkol sa ating atay at paano alagaan ito. Before I introduce ang moderator sa usapin natin ngayong hapon, ipapaalala ko lang ang ating mga webinar rules. Panatilihin po natin naka-mute or silent mode ang ating mga gadget. Paki-off po ang camera habang ongoing ang lecture proper. Maari na po ninyong buksan ang mga camera kapag nasa question and answer portion na po tayo ng webinar. Kung magkakaproblema sa connection, mag-log out lamang at mag-login na muli gamit ang link na inyong pong ginamit or to join manually to type the meeting ID and the passcode. Inaanyayahan po ang lahat na mag-type ng inyong mga katanungan sa chat box para sa ating open forum anytime during the lecture at matapos ang lecture proper. Now, to introduce our moderator, he graduated as Doctor of Medicine sa UST Faculty of Medicine and Surgery and had his residency in internal medicine at the Chinese General Hospital. He furthered his studies and had his fellowship in gastroenterology at UST Hospital. He is a fellow of the Philippine College of Physicians, Philippine Society of Gastroenterology, and Philippine Society of Digestive Endoscopy. He is a practicing gastroenterologist and digestive endoscopist at Ace Bay Point Hospital, James L. Gordon Memorial Hospital, and Redon St. Jude Medical Center. And he is our current auditor of the Olongapo City Medical Society. May I now call on Dr. Paolo Villareal.
Good afternoon po. So bago ko po, yes, can you share slides? So ang ating speaker po today ay ang aking matalik na kaibigan po, no, si Dra Arl Ann Manzo. So she graduated her Doctor of Medicine at UST Medicine and Surgery, had her residency training in internal medicine and as well as gastroenterology at UST Hospital. She is also a fellow of Philippine College of Physicians, Philippine Society of Gastroenterology, Philippine Society of Digestive Endoscopy. She serves as a former clinical instructor at the UST Faculty of Medicine and Surgery. So currently, she is practicing gastroenterology and digestive endoscopy at Ace Bay Point Hospital, James L. Gordon Memorial Hospital, Redon St. Jude Medical Center, UST Hospital, and the Medical City Clark. So let us welcome our speaker for today, Dra Arl Ann Manzo.
Magandang hapon po sa inyong lahat. Maraming salamat po kay Dr. Villareal sa kanyang introduction. If I may share my screen. Nakikita na po bang maigi ang aking slides?
Wala pa, wala pa.
Wala. Yeah. Nakita na po ba?
Yeah, okay na. Clear.
Magandang hapon po ulit sa inyong lahat. Maraming salamat po sa imbitasyon ng Olongapo City Medical Society para sa isang oportunidad na makapagbahagi ng kaalaman sa ating mga tigapakinig ngayong hapon. Ang akin pong topic, ang ating pong usapin ngayong hapon ay ang tungkol po sa tamang pagbabantay sa ating mga atay. But we will zero in on liver cancer awareness as it is the highlight of this afternoon's topic. Before I begin, I would just like to say that I have nothing to disclose. And the references from my lecture are from the different clinical practice guidelines as stated, and also some excerpts, some information from the different online sites I mentioned in this slide. Ang atin pong mga objectives o ang mga pakay po ng ating usapin ngayong hapon, unang-una ay upang kilalanin ang ating atay. At kung kilala na natin ang ating atay at ang kahalagahan nito, ating malalaman na yung hapon kung paano natin malalaman if we need help, if we need to consult with our doctor, or if there's something wrong that our liver is telling us. But the bulk of our conversation, our topic for this afternoon is to understand liver cancer. Para humalaman natin yung risk factors, yung sintomas, paano natin ito matutukoy, paano gagaling, at kung paano natin maiiwas magkaroon ng cancer sa atay. Ano nga ba ang atay? So this is a cone-shaped organ about the size of a football. Sa mga kababaihan ho, mga nasa 7 centimeters ang laki ng ating atay. Sa mga lalaki naman, around 10 centimeters. More or less, 2 to 3 centimeters po ang variation depending on the build of the person. It sits at the right upper side of our abdomen, just below the rib cage. Ito po ang pinakamalaking solid organ ng ating katawan. At dahil ito po ang pinakamalaki, marami din po itong essential biofunctions. Almost 500 nga daw po ang functions ng atay. Hindi na natin iisa-isahin yan, pero bibigyan ko kayo ng konting kaalaman kung bakit mahalaga ang atay sa isang tao. Unang-una po, for detoxification. Malamang naririnig nyo yung salitang detox. Ano ba ang ginagawa ng atay para tulungan tayo sa pagtanggal ng waste products? Ang mga toxic chemicals po at substances, most of the time, they are lipid soluble. Lipophilic po sila. Dumidikit sa mga fats para ma-absorb ng katawan. Now, what the liver does, it makes these lipid-soluble substances dissolvable in water. Gagawin niyang water-soluble. Anong kahalagahan nito? Para mailabas natin sa ating ihi, sa ating urine. The vital organ, the liver, is responsible for that form of detoxification. It also has a role in immunity. Paano nakakatulong? Ito pong COVID, kaliwat kanan, naririnig natin yan. Immune system, immune defense, to make our immunity strong, right? Because this is our defense against infection, against insults to the body. How does the liver do it? Sa loob po ng atay, meron hong mga tinatawag na Kupffer cells. Itong mga Kupffer cells na ito, kung pamilyar po kayo dun sa laro ng Pac-Man, mga batang 90s kagaya ko, kilala niyo ho si Pac-Man, diba? Kinakain niya yung mga nadadaanan niyang bilog, kinakain niya yung mga kalaban na ibang kulay sa game. So this is exactly what the Kupffer cells do. It eats up, it ingests these pathogens, especially the bacteria that enters the gut or the GI tract, to prevent it from causing injury to the body. Kaya po ang ginagawa ng atay in terms of immunity. Now, it is very significant also in terms of metabolism. Kung alam po ninyo yung term na hormones, malamang naririnig nyo yan. Hormones sa mga babae sa menopause, thyroid hormone sa mga naoperahan sa thyroid, pero hindi po yan yung klase ng hormone na napoproduce ng atay. Marami yan, but the most important ones are these three I mentioned in this slide. Yung angiotensinogen, ang trabaho nito is pag-regulate ng blood pressure. So malamang hindi natin alam ng nakakarami yan na may kinalaman pala ang blood pressure regulation, ang liver sa blood pressure regulation. Yun naman pong IGF-1 o yung tinatawag na insulin growth factor 1. Iba po ito dun sa insulin ng pang-diabetes kasi po yung pancreas natin ang nagpo-produce niyan. IGF-1 hormone has something to do with yung growth hormone, yung pagtangkad ng mga kabataan at may kinalaman din ho sa pang-cancers na katawan. Yung thrombopoietin naman, maririnig niyo po ito dun sa mga may dengue. So you're familiar with the platelet count sa ating CBC. Ang liver natin ang nagpo-produce ng hormone that is responsible for the body to create these platelets. Yan po ang thrombopoietin. Ito namang glycogen storage has something to do with our energy reserves. So the body has its own way of conserving energy storage. So it comes in the form of glycogen and it is stored predominantly in the liver and the skeletal tissues. Meron din ho yan sa kidneys, meron din ho sa brain, meron din sa red cells, but most of the energy reserves are stored in the liver. Another is yung clotting factors. Familiar kayo dyan sa mga pagpapaampat ng dugo. Pag nagginalusa, nasugat, nauntog, yung pagpapasa. Clotting factors are responsible for that. And the vitamin K-dependent clotting factors are produced in the liver also. And of course, bile. So yun sa mga mahilig kong kumain ng papaitan, yung mapait. Ito po yung tinatawag na panunaw natin. Tumutulong po ito sa ating digestion, o pag nandun na ho yung pagkain sa loob ng ating bituka. But more importantly, this bile helps us break down the fat that we ingest. So ang dami pa yan. Mga importansya o mga mahahalagang functions ng ating liver. The next question is, when do I get my liver checked? Lalo na yon, mas naging aware ang mga tao tungkol sa kalusugan, mas naging health conscious tayo. Kumbaga, we realize that life is short because of this pandemic, and if anything, we value our health more. Now, when it comes to the liver, is there really a set guideline to when to get your liver checked para ipa-check up ang atay? Tama po, actually it can be done at any age. Importante na ma-assess ang ating risk factor. I've listed down here the 4 most common risk factors for liver disease in general. So iisa-isahin natin po ang mga ito. I posted here some screenshots of latest journals showing us the link between fatty liver disease and diabetes. Ang diabetes po, madami na yan. It is also one of the top leading causes of illnesses and also in the top 10 causes of death in people worldwide. Ano ang kahalagahan ng diabetes sa usapan natin na yung hapon? Meron po, because there is a complex link, a direct link between diabetes and liver disease. Specifically your non-alcoholic fatty liver disease. I-discuss po natin yan mamaya. Maliban po dito, if your family has a history of other liver diseases, hindi ho ito common, pero minsan meron hong nababanggit na mga familial diseases of the liver, inherited diseases of the liver, yung mga hemochromatosis na tinatawag. So if usually these diseases, if it's present in the family, napag-uusapan naman po yan. So kung may ganun sa inyong lahi, it is best to get your liver checked as early as possible. Significant alcohol drinking. Mahilig isagot ng mga pasyente pag tinatanong sa clinic, occasional, doc, or moderate, doc. Paano ba talaga malalaman kung ano ang acceptable alcohol intake at kung ano ang significant alcohol intake? Sa akin pong pagbabasa, habang naghahanda po sa lecture na ito, naghahanap ako baka merong Philippine guidelines or Philippine acceptable alcohol intake, pero sadyang wala. What I came across was the Centers for Disease Control and Prevention. You are familiar with this. Because of the pandemic, we see the CDC posting guidelines and other researches and data for us to use. So according to the CDC, for men, 2 drinks or less a day ang acceptable. For women, 1 drink or less a day. Why is it different from heavy drinking and binge drinking? Malalaman po natin later. Kasi po, kung mag-i-exceed tayo sa acceptable alcohol intake, we put the liver at risk for injury. Ano ba yung heavy drinking? Hindi po pamantayan yung pag nalasing na, heavy drinking na yon. Kasi may mga tao ho na mataas ang tolerance. Again, this is quantified by the amount that you drink. If you consume 15 drinks or more a week, that is already heavy drinking for men. And for women, if you consume 8 drinks or more per week, that is already considered heavy drinking. Ano naman yung binge drinking? May okasyon, nag-birthday, Christmas, New Year. So 5 drinks or more per occasion is considered binge drinking in men and 4 drinks or more for women. Magtataka kayo, bakit mas mababa ata ang requirement para maging significant sa babae? Diyan po papasok yung alcohol dehydrogenase. So alcohol dehydrogenase is the body's enzyme, the liver's enzyme, that helps us break down alcohol and its metabolites. Physiologically, women produce less compared to men. That's why our alcohol tolerance, it would translate that it's less compared to men. Pero iba-iba po ito. This is just a general observation. This is just what is generally seen. But there are, of course, exceptions to the rule. Some women can drink more than men and they're more tolerant than men or vice versa. Pero ito po ang tatandaan natin. Ang mas importante, it's not really the gender but the amount that you are taking at any given time. Hepatitis B or C, most of the time, this is diagnosed through work clearances. For your information po, ang latest data, 8.5 million Filipinos ang may chronic hepatitis B. Ito pong mga infeksyon na to, mga sakit na ito, kapag chronic, yan ho ang nakakatakot para sa atay. At kapag chronic, kadalasan wala hong sintomas sa una. Nararamdaman lang ang sintomas kapag malala na, or yun nga, sa akin po swerte yon na pag nag-work clearance at nakita na positive for Hepa B or Hepa C, that's a good sign because that is giving the patient or the person a chance to get screened for liver diseases. Didiscuss natin mamaya kung bakit ang Hep B at Hep C ay kasama sa mga risk for liver diseases and our topic of liver cancer as well. Unhealthy lifestyle. Not to be judgmental or anything, but we have to admit there are things we do that really do put us at risk for cancer or for other liver diseases. Talking about liver disease in general, ayan po, lahat halos ata tayo na nagstay at home at nag-work from home, nalimutan ng mag-exercise, nakalimot na rin sa pagkain. So a lot of us had significant weight gain because of the pandemic. This is kind of scary because this will put us at risk excuse me, to develop liver diseases. Another is kaliwat kanan, lumalabas yung mga liver supplements. Mga not just liver supplements, but supplements for immunity na tinatawag, supplements for weight loss. Ito pong mga herbal na quote-unquote supplementation. There is a list of hepatotoxic supplements, herbal supplements. So we should be wary of these things that we take because this can also put our liver at risk for disease. Ang hepatitis, gaya ng nabanggit ko, viral hepatitis B and C, ito po ay bloodborne. This is an infectious illness and it's bloodborne. So there are some lifestyle choices that can put us at risk. Multiple sexual partners, unprotected intercourse, sharing needles sa mga nag-IV drug use. Ito po ang ilan sa mga risky lifestyle choices that can put us at risk to having liver disease. So kung meron kang nasagot dun sa mga nabanggit ko, maybe it's high time to get your liver checked. What test do I need to do? What is it that we need to do to check the liver? Well, some patients come to us already with labs done. Okay lang naman po yun. But first, it's very important to talk to your doctor. Routine blood chemistry workup, including your blood sugar, your SGPT, those things that you do routinely are acceptable. And of course, imaging is important also, and we do that with an ultrasound. Kaya ko po nabanggit kasi paminsan medyo nasosobrahan ng mga test na pinagagawa, nagagastusan po tayo ng hindi kinakailangan. So, important before you get your tests done for your liver checkup to talk to your doctor first. Ito po ang ating paboritong naririnig pag-usapang liver. SGPT, SGOT, generally termed as your transaminases or your LFTs, liver function test. These are actually specific tests if you want to assess the liver function level or the level of liver injury. These are non-fasting tests, so anytime pwedeng magpa-extract, and this is routinely done at the laboratory. Ito po kasing mga enzymes na to, nabanggit natin yung mga enzymes kanina, mga biochemical substances in the body that help us in our bodily functions, in our physiologic functions. These enzymes, these liver function tests, this SGPT, these transaminases are in the liver. Nasa loob po ng cells ng liver yan. Pag nai-injure yung liver, nasi-spill out sila, lumalabas sa bloodstream, kaya nadedetect sa blood. So that's the rationale behind elevations in your SGPT and SGOT. Kaya pag ito pong dalawa, yung nakikita sa blood chem na ay mataas, automatically it tells your doctor that there's something amiss with your liver function. Eh ano naman ang silbi ng ibang test? Pag tumaas ho ang SGPT at SGOT, nakita ng doktor na mataas ito, it is important to know the cause of this elevation. Most of the time, it is related to other tests as well. So we get an FBS to check for the blood sugar level. We get the lipid profile or the cholesterol level if we are considering or trying to rule out viral hepatitis, and we request for a hepatitis profile. Ito pong mga special tests for the liver, yung mga may patients sa audience, mga relatives na may liver disease, o kung kayo po mismo ang mga liver disease patients, familiar kayo sa mga prothrombin, DPAG, albumin, bilirubin. These are special tests. So we don't request for these tests routinely. We request it as indicated depending on the patient. Okay, when is a liver function test recommended other than for general checkup or to screen for liver disease if you are symptomatic? So if the patient or the person has yellowish discoloration of the eyes or of the skin, if the patient noticed that the urine is iced tea-colored yan, the dark urine, if there's unexplained tiredness, nausea, vomiting, these are symptoms that can suggest a problem in the liver. So you get an LFT. There are certain drugs. Huwag naman po kayong matakot sa mga nire-reseta. Paborito din yung sinasabi yan na okay lang po ba yung gamot na to para sa atay? That's good. I appreciate patients who ask me those things kasi at least aware na may mga ini-ingest na gamot na pwedeng makapinsala sa atay. It is the discretion of your doctor. So, hindi naman po kayo ipapahamak ng inyong mga doktor. Kaya po paminsan, pag may mga niresetang certain drugs, the doctor who prescribed these drugs to you also give you tests to monitor your liver function. Kasi totoo po nga na may mga gamot na nire-reseta na pwedeng makapagpataas ng liver enzyme. And of course, if you are already a known case or if you have known liver disease, LFTs are requested to monitor the progression or the status of your liver disease. And if you are undergoing treatment, this is also used to assess your response. Eto na. So what does it mean? Is there a should I panic? Should I worry if my SGPT or SGOT levels are elevated? As I mentioned, hindi ho ito tataas kung walang liver injury or kung walang problema dun sa tinatawag na biliary tract. Yun ho, sa loob ng katawan natin, meron tayong mga organs na katabi ng atay na po pwede ring mag-cause ng elevation ng SGPT at SGOT. Kung makikita po ninyo dito sa screen, may picture na nakalagay fatty liver. So today, I want to be able to correct that notion that fatty liver is just that. Fatty liver na may kaugnayan sa mataba, may kaugnayan sa pagkain ng taba, pag may kaugnayan sa diabetes. Hindi po ganun yun. Ang fatty liver po is actually a general term that corresponds to any form of liver inflammation. It is the first sign or the start of liver injury. Kasi po, pag nasisira o nadadamage natin yung atay, pag namamaga ang atay, ang nangyayari po, nagkakaroon ng fat deposition. So this is actually the first sign of injury. Pag nagkaroon na po ng liver injury yan, fatty liver yan, kadalasan walang sintomas yan. Mataas lang ang SGPT at SGOT, kailangan alamin ang dahilan kung bakit tumataas para hindi na ho mag-progress. Kasi kung titignan nyo ho dito sa pictures dito, nagsa-start out siya as liver injury, fatty liver lang. Habang tumatagal, kung di natin naaagapan, pwede hong lumala. Hanggang sa umabot dun sa ating pag-uusapan mamaya, which is liver cancer. So again, liver injury in general is called fatty liver, and we have to find out what causes it for us to be able to treat. Ito na po yun. So ito yung NAFLD na sinasabi o yung fatty liver. Importante ho dyan yung non-alcoholic fatty liver disease. Because if we talk about non-alcoholic fatty liver disease, surely dapat ho sigurado that the patient does not fall under significant alcohol drinking. So natatandaan nyo pa yun, di ba? Ano ang acceptable drinking? Kung hindi naman siya nag-i-exceed doon at mataas ang SGPT, SGOT, at na-rule out natin ang other causes, then we say that it's NAFLD or non-alcoholic fatty liver disease. Nilagay ko po dito yung picture ng overweight because it is related to metabolic syndrome. Pag mataas ang asukal, mataas ang cholesterol sa dugo. But make no mistake, hindi lang ho matataba ang nagkaka-NAFLD, lalo na ho sa mga Pilipino, sa mga Asians. Our body habitus compared to the Americans and the Europeans, mas maliliit tayo, mas balingkinita na tinatawag, di po ba? So it doesn't mean that if you're thin, walang fatty liver yan. It doesn't also mean na ang taba mo may fatty liver ka. So it's important to get yourself assessed. Alam mo naman mahilig ako sa sisig, mahilig ako sa chicharon bulaklak, ayan. Or if it's in the family, may family history ako ng diabetes, nagtitake ng mga gamot pang cholesterol ang nanay ko. So these things, you know that you're at risk to develop NAFLD. Kaya to be on the safe side, better to keep our weight at the healthiest level. Again, paulit-ulit si doktora, bakit ba inuulit-ulit itong hepatitis B or C? Kasi nga po, this is like a thief in the night. Okay ka, wala kang nararamdaman, mataas lang yung SGPT, yung pala Hepa B. Hanggat hindi ho ito gagamutin, nakakatakot po para sa pasyente. Maliban sa maaari hong makahawa, lalo na po ang mga kababaihan. Kapag nanganak, maaari hong ihawa sa bagong panganak na sanggol kung Hepa B po ang nanay na hindi na-treat o hindi na-check. Kasi po, predominantly sa 8.5 million na Pinoy na may Hepa B, ang unang dahilan ho ng transmission is maternal fetal. Nakakatakot ho itong virus na ito kasi ito po ay maliban sa masisira niya yung atay, cancerous ho ang hepatitis B at C. And again, alcoholic hepatitis. Make no mistake, this is not a simple problem. As the WHO reported, about 140 million people have alcohol dependency. At 40% ho, almost half of those people with alcohol dependency will have alcoholic hepatitis and might die within 6 months. So hindi po biro. Kailangan natin talagang keep ourselves in check all the time. Am I drinking right? Should I really do this? I should always drink within the acceptable limits to prevent alcoholic hepatitis. And as again, I mentioned, drug-induced hepatitis. Ayan, kaliwat kanan, dami nating iniinom. Pang-immunity daw to, pang-boost daw to, mga injection na hindi natin alam kung talagang proven o kung talagang napatunayan na makakatulong sa katawan. Ito pong mga drug-induced liver injury ay pwede hong magdire-diretso at maging risk to develop chronic liver disease. So itong mga bagay na ito ang kailangan nating bantayan. I-check, make a mental note within your minds right now. Meron ba ako nito? Meron ba ako nito? And if you only answer just one, that's enough to get your liver checked. Okay? Are there other ways? Sapat na ba ang blood test o meron tayong ibang pwedeng gawin? Dito po papasok yung mga tinatawag na imaging tests. Ito po ay mga mahahalagang eksaminasyon upang mailarawan ng ating atay. Ultrasound ang pinakasimple at pinakamurang paraan. Meron din hong CT scan, may MRI at yung PET scan. As I said, the ultrasound is the cheapest, most simple, and the non-invasive way to evaluate your liver. Ito rin po ay walang ionizing radiation, kaya safe na safe. Importante po ito kung yung atay ang gusto nating makita. For your information in the audience, for the non-doctors in the audience, ang ultrasound po ay isang magandang baseline o pangunang eksaminasyon para makita yung atay. Ginagamit po ito, kailangan po prepared tayo, well-prepared, fasted well, para walang impedance na tinatawag, para wala hong sagabal sa pag-evaluate, so pag-visualize ng ating liver. Kasi po yung ultrasound, kung makikita nyo po sa picture, it relies on sound waves. So that transducer there, the gray thing that you see behind the lady, that will be used to move back and forth in the abdomen, and that transducer will send us into the computer. It will give, the sound waves will be interpreted as a visualized, as a picture para makita kung fatty liver, kung may bukol. So sapat na po ang ultrasound sa pangunang eksaminasyon. And that is important for you to have a preparation before you have it done. Kasi laging may mga nakikiusap na bakit kailangan pa, hindi ba pwedeng ipagawa na or nagagalit ho sa fasting. Importante ho ang fasting for ultrasound, again, so that there's no air, there's no interference, and it would give us the best picture for your liver. Ito pong transient elastography, if some of you have been requested to get this done, or if you have relatives, you have to get this done. The common brand name is your FibroScan. This is a more special, more sensitive test to visualize the liver. This is otherwise known as your non-invasive liver biopsy. Meron ho siyang makabagong, kakaibang teknolohiya compared sa routine ultrasound for us to be able to see the liver stiffness po na tinatawag. So ito po ay para sa mga taong alam nang may fatty liver at gustong malaman ng doktor kung gaano kalala yung severity ng fatty liver, so we request for a transient elastography. CT scan and MRI, again, we don't request this for routine checkup. Usually, these special and more sensitive tests are requested by your doctor if they're looking for something more serious. For example, you have high risk for other illnesses or you have symptoms suggesting other more serious liver illnesses, then we do a CT or an MRI. That is the only purpose of doing this. We don't advise doing it just for a general checkup. Kung ako ay may risk factor, now we're talking about screening now for liver cancer. So yung kanina, liver disease, you get your blood chem check and your ultrasound. If you don't have abnormal tests, if your ultrasound is normal, at wala ka namang risk factors na nabanggit natin, so an annual checkup of your ultrasound and your blood chem would suffice. Pero kung may risk factors ka or kung may known liver disease ka na, ano ang kailangan gawin para ma-screen for liver cancer? Based on the clinical practice guidelines of the Hepatology Society of the Philippines, yan ho ang susundin natin bilang tayo ho ay mga Pinoy. Most of us at least in the audience. So you get a biannual ultrasound of the liver with or without alpha-fetoprotein. Ito pong alpha-fetoprotein is a tumor marker. So isa po itong test sa dugo na again will be under the discretion of your doctor if you need it or not. Okay. Now, let's go to the topic at hand. Ito ang haba ng introduction. Now, we will go to liver cancer itself. Ano nga ba ang cancer sa atay? Simply put, it is cancer that begins in the liver cells. There are actually several types of cancers that form in the liver, but the most common is hepatocellular cancer. You know, yung tumubo sa loob ng atay mismo. Another common type, probably some of those in the audience are familiar with this, yun hong liver metastasis or metastatic disease of the liver. Nagkaka-cancer ho sa ibang organs and then kumakalat po o nagsispread na po sa atay. Okay, so how do you get liver cancer? This is an entirely different risk factor. Baka malito po kayo. Kanina ang usapan natin is liver disease kasi parang mas maraming risk factors na yon. Talking about liver cancer in particular. Gender. Males are generally more prone to develop liver cancer compared to women. Asian ethnicity based on published journals, mga researches, yun pong mga Asian Americans, mga Pacific Islanders, pasok po ang Pinoy doon. We are actually at risk to develop liver cancer compared to other races and other ethnicities. Chronic viral hepatitis, not only a risk factor to develop chronic liver disease, but liver cancer in particular. Liver cirrhosis, discuss natin quickly, ano ba yung liver cirrhosis na yan? NAFLD, we mentioned it earlier, heavy alcohol use, smoking, obesity, diabetes, aflatoxins, ito po yung toxins na galing sa spoiled nuts and corn. So when you eat nuts and corn, make sure that it's not spoiled, make sure hindi na matagal na nakastore sa pantry kasi ito pong aflatoxins cause liver cancer. And new data now has given us information that anabolic steroids can increase your cancer risk. Ito po yung mga steroids na ini-inject illegally ng mga athletes, ng mga bodybuilders. Ayan. What are the symptoms? Unfortunately, liver cancer po falls under the type of cancers na initially walang symptom, kaya mahalaga ho ang screening. Nagkakaroon ho ng sintomas ang pasyente, sadly, kapag advanced disease na o kapag malala na. So minsan ho, ito po mga nakikita nating sintomas ng may cancer sa atay. Pero wag po kayong matakot. Hindi naman ibig sabihin meron kayong check dito o isa o dalawa dito, nagkaroon kayo, cancer sa atay na kaagad. O kaya kailangan po lagi, teamwork kayo at ang inyong doktor. So pag masakit ho ng tiyan sa may right upper quadrant, right upper side ng abdomen, paminsan ho it radiates or it is referred to the right shoulder, paninilaw ng balat, pangangayayat na walang ibang dahilan, kawalan ng ganang kumain, napapagod na walang ibang dahilan, buong araw ka naman palang nag-chores, tapos napagod ka, akala mo liver cancer na, or nag-diet ka kasi mataas yung SGPT mo, akala mo liver cancer na. So dapat po ay walang ibang dahilan. Paminsan po, mga tao po na may matinding kabag ay pwedeng sintomas din ng cancer sa atay. Pero yun ho yung yung description na matindi. Hindi naman porque kinakabagan, liver cancer na kaagad. How is liver cancer diagnosed? Iba po ito dun sa napag-usapan natin sa liver disease. When we are talking about liver cancer, meron po tayong pamantayang sinusunod. Ito po yung nabanggit kong clinical practice guidelines. There are actually a lot of staging systems for cancer. The doctors in the audience are probably familiar with the NCCN. But also for cancer, what we use is the BCLC po, ang tawag dyan sa staging, or the Barcelona Clinic Liver Cancer Staging. Yan hong medyo toxic looking na slide, na picture dyan sa slide na yan, na nakikita nyo na yon sa screen, yung flowchart dyan, yan ho yung BCLC. Gaya ho sa ibang cancer, ganun din po sa liver cancer. Ganun din ang ating tamang proseso. You diagnose, you stage, and then your treatment will depend on the patient's stage. So this is an example of how we diagnose liver cancer. Sometimes we go straight to a CT or an MR, but most of the time, since this is something that is not symptomatic at first, the patient will have an ultrasound first, and there's a liver mass on ultrasound, and then the doctor mandates the patient to have further imaging. Para ho kasi ma-diagnose, kailangan natin either a CT scan or an MRI. Ito po yung tinawag na mga dynamic studies. Yung nasa taas po na rectangular image dyan sa inyong screen, yan ho ang example ng CT scan ng liver cancer. Doon naman po sa baba, nakikita nyo yung square sa baba, sa left-hand side, left lower side po ng screen, shows MRI images of hepatocellular carcinoma. Pagka po sapat na at sumunod na po sa pamantayan o sa guidelines, yung characteristic ng bukol sa CT scan or sa MRI, yan po yung tinatawag natin na arterial enhancement and portal venous washout. Yan po yung mga technical na terms. So that already is enough, that would suffice to diagnose liver cancer based on guidelines. Pero paminsan, it happens din na hindi ho makapag-commit. Minsan, hindi talagang kitang-kita yung hinahanap na characteristics. So naturally, our radiologists would not be able to commit that this is the typical arterial enhancement or this is the typical portal venous washout. It does happen. And if that happens, that the imaging result cannot commit to the characteristics of the tumor, then we do a liver biopsy. Yung liver biopsy po o yung pagkuha ng sample ng laman ng bukol sa loob ng atay. This is enough kung familiar po sa audience yung tinatawag na fine needle. Di ba? Minsan, pag may mga bukol tayo, halimbawa sa suso o kulani, sa leeg, sapat na ho maliit na hiringgilya na pang biopsy para kumuha ng kakapiranggot na laman. That would suffice for that purpose. But we need to do what we call a core needle biopsy. If you can see in the picture at the right lower hand corner in your screen, iba ho ang specimen na kinukuha natin. Mas mataba ng konti, mas malaki po siya. Yan ho ang magbibigay sa atin ng talagang mas sensitibong diagnosis for liver cancer if imaging studies cannot commit to the characteristics of HCC. HCC ho ang shortcut for hepatocellular carcinoma or cancer sa atay. Yung kulay pink po na picture, yan po yung itsura na nakikita ng mga pathologists telling them that, oh, this is HCC. Ayun ang pinakamahalagang susunod na tanong. No? Na-diagnose na liver cancer ito, ang liver cancer po ba ay nagagamot? Gone are the days that a cancer diagnosis equates to a death sentence. Marami na hong bagong pamamaraan, marami na hong bagong teknolohiya. So let us not despair if we get a liver cancer diagnosis or any cancer diagnosis for that matter. Gaya ho ng kahit na anong bukol sa katawan na maaaring matanggal at proven na cancerous o kaduda-dudang cancer, surgery po ang pinakamagandang paraan para matanggal ang tawag po ng surgeons natin dito ay yung source control. Tanggalin ang source. Same goes with the liver. Early stages of liver cancer, small tumors proven to be liver cancer, we can operate. We can do what our surgeons call a hepatectomy. Ang kagandahan ho kasi ng ating atay, it can regenerate itself. So kapag meron pong injury, pwede ho niyang ibalik ang dati niyang function. Pero yun din ho ang nakakatakot sa atay because of its regenerative properties. Kasi di ba, pagka nasugat, gagaling magpepeklat. Dahil may kakayahan hong gawin ng atayan to regenerate itself, nagpo-form po siya ng anong nangyayari pag nagkakasugat tayo tapos kumagaling, nagpepeklat. Yang peklat na yan ho ang nakakatakot sa atay. So yung ulit-ulit na injury, gagaling, peklat, yan ho nagsa-start yan. We call that fibrosis. And then eventually, liver fibrosis would end up to be liver cirrhosis. Short of saying, siguro, it's safe to say that liver cirrhosis is when the entire liver becomes a scar tissue because of repeated injury and repair, and it no longer functions. Ang kaibahan ho ng fibrosis sa cirrhosis, if it's fibrosis, pwedeng may function pa eh. Pero pag cirrhotic na ho ang atay, function is impaired and it's irreversible. Okay? Surgery, in addition to hepatectomy o yung pagtanggal ng portion ng bukol ay ng atay na may bukol, pwede rin hong liver transplant. We have specialized centers in the Philippines that offer liver transplant. Kaya lang, ang deterrent natin is yung cost. I saw some data as well that liver transplant in our country could set the patient back around 6 to 9. Okay, what about frequency ablation? This is procedure similar to biopsy. Ang kaibahan po nito ay gumagamit ng radio frequency waves. Makikita niyo po doon sa drawing, kung may radio frequency waves, this is actually electricity waves. It is sent to the tumor via this needle electrode, and this is done by ultrasound guidance. What happens is the electricity, the radio frequency waves destroys the tumor. And pag nasira na yung tumor, so dead tissue na yan, ito na si Kupffer cells, sina Pacman. Kakainin nila yung mga nasirang cells ng tumor ng electricity na binigay ng radio frequency waves. Kaya ho, nakakaliit siya. So pag kinain na ng Kupffer cells yung destroyed cells of the tumor, it shrinks the size of the tumor. Pag na-shrink yung size ng tumor, maaaring maging amenable na to surgery or maaaring sapat na yan na treatment in early stage liver cancer. So yan yung RFA na tinatawag. Another is yung TACE, yung transarterial chemoembolization. Simply put, ang ginagawa lang po, merong probe, merong catheter na ipapasok sa loob ng malaking ugat. Kadalasan ho sa singit ang daan niyan. At hahanapin po yung blood supply ng bukol sa atay. Pag natukoy po ng interventional radiologist kung saan yung source ng blood supply ng cancer, ng tumor sa liver, mag-i-inject po ng chemo doon para it kills the blood supply of that tumor. Of course, the blood supply is the source of nutrition, the nutrients and the oxygen for the tumor to grow. So pag pinatay na ho yung blood supply ng tumor, hindi na siya lalaki. Ito pong TACE, based po dun sa ating staging, ginagamit po ito pag medyo malaki na yung bukol at hindi na ho amenable sa RFA o sa pag-opera. Ang bago pong labas na teknolohiya na yon ay yung SIRT, yung CERT na tinatawag, yan po yung radioembolization or what we call the selective internal radiation therapy. In addition po, di ba si TACE magdadaan ng chemo sa ugat. Ito po may kasamang radiation beads. So may beads of radiation na sabay ipapasok. But this is still, based on the guidelines, wala pa pong enough evidence for Filipino patients at this time. Although sa Amerika, sa Europa, sa ibang bansa, ginagawa na po ang CERT for liver cancer. Systemic treatment. So, mga cancers, iba-iba po ito pagdating sa liver cancer. Meron pong chemo, familiar na po kayo dyan. No, chemotherapeutic agents are drugs that kill cancer cells. Pinipigilan ho si cancer na mag-reproduce kasi ang nakakatakot po sa cancer cells compared to normal cells, mas mabilis ho yung tinatawag na cell turnover or mabilis ho silang mag-grow, mag-multiply, mag-duplicate, ganyan. Kaya ang trabaho ng chemo para ma-stop sila from growing or from multiplying to further destroying the body or enlarging the cancer, the tumor in the liver. Kaya lamang hindi ho maganda masyado ang response ng liver cancer sa mga chemo. Ito po yung mga nababanggit, kung familiar po ang ating audience, yung mga cisplatin, gemcitabine, yan pong mga chemo na yan. It shows that for liver cancer, hindi ho sila masyadong responsive. Kaya po for systemic treatment, kung hindi ho mag-RF, kung hindi ho magsa-surgery, kung hindi ho mag-DTase or radioembolization, we do other forms of systemic treatment that are shown to be more effective for liver cancer. Ito po yung targeted therapy, yung immunotherapy. I will try my best to make it as comprehensive as possible to the non-doctors in the audience. May po pala ako ng paumanhin kung paminsan po may mga medical terms talagang mahirap i-translate. Anyway, targeted therapy po, ang keyword dito is your kinase inhibitors. Kasi po itong mga kinase na to ang responsible, mga protein po yan na present din sa cancer cells natin. Kasi yung pong cancer cells, if you must know, galing ho yan sa normal cells din na nag-mutate o nagkaroon ho ng pagbabago, kaya naging cancer cells sila. So ito pong mga cancer cells, meron po yung kinase. Yung kinase po, it gives the cancer cells help to grow. And also, it helps the cancer cells in angiogenesis na tinatawag. Ang cancer cells po, kaya sila mabilis mag-grow kasi gumagawa sila ng sarili nilang blood supply. Napakagaling, di ba? So, gagaling to grow sila. Gagawa pa sila ng sarili nilang blood supply to nourish itself independently from the body. Ang ginagawa po ni kinase, pareho niyang tinatarget. Targets the growth of the cancer cells and targets the cancer's ability to produce new vessels for itself. Yun po yung mga naririnig na sorafenib, lenvatinib, yan po yung mga targeted therapy. Yung immune therapy naman po ay may kinalaman sa immune system. Kasi yung immune system ho yung parang pinaka-checkpoint ng katawan natin. So siya yung magsasabi na, pwede tayong, yan, kaya nga na-activate ng bakuna, di ba? So yan ang nagsasabi sa atin na, kumbaga meron hong checkpoint mechanism yung immune system na which is good for the body and what is not good for the body. That which is not good for the body, that the immune system detects na hindi good, sisirain niya para hindi na ho makapinsala sa katawan. Ang ginagawa ho nitong mga cancer cells, binabypass ho nila yung ating checkpoint. Kaya kahit na bad cells sila, na-detect ng katawan na ay hindi ka bad, papayagan kang manirahan at mag-grow dyan. Kumbaga binabypass ho yung immune system. Yun ho yung trabaho ng immunotherapy para makialam dun sa immune system changes na dinidisrupt po ng cancer cells. Kasi syempre, pag na-detect ng body na, bad cells tong si cancer cells, tutulungan po tayo ng katawan nating patayin. So ito po yung mga naririnig ninyo na may mab sa dulo, yung mga bevacizumab, na ganyan. Yan ho yung mga immunotherapy na gamot sa cancer ng liver. Why is it important to know about prognosis? Why is it important to know the survival rates of any cancer, or for liver cancer, as our topic this afternoon? Para ba makapagbigay si Doc ng tanning o in 6 months, patay ka na, in 1 year, get your affairs in order, you're dying in a year. Sa tingin ko po, hindi yun ang purpose of knowing the survival rates. Para ho, mas maging agresibo tayo sa pag-alaga sa ating mga katawan, sa pagpapascreen at sa pagpapacheck up. Kasi po, kapag early diagnosis at early treatment, the 5-year relative survival rate for liver cancer or for any cancer is higher. Kumpara sa late na, di na magamot or di na magpapagamot, tingnan nyo po 34% versus 3%. Studies have shown early cancer na treated, ang 5-year relative survival rate po, it can be as high as 60 to 70%. Kaya ang purpose nito ay hindi para takutin tayo, kundi para malaman natin na kung maaga pa lang ma-diagnose, kung maaga pala akong magpapagamot, pwede akong maging cancer survivor. Pwede kong matalo ang cancer. So yun po ang purpose of knowing the prognosis and survival rates. Is liver cancer preventable? Sana. Sana magkaroon ng gamot na makakapag-prevent ng cancer. Pumapangalawa sa tingin ko sa mga bakuna na imbensyon, kung makaka-imbento talaga ng gamot na makakapag-prevent ng cancer or liver cancer. Wala pong gamot but it is preventable. Yes, it is. It is preventable by reducing one's exposure to known risk factors. Ito pong 9 easy ways, I lifted this from the American Cancer Society website. This is not just liver cancer in particular, but all cancers. So be healthy, lifestyle choices, and get yourself vaccine. Actually po may mga bakuna na nakakapagprotekta din sa atin, sa ating risk for liver cancer or other cancers. Ayan, ang hirap marinig for patients with NAFLD. Yan ang isipin natin. If you have non-alcoholic fatty liver disease, you are at risk to develop liver cirrhosis. And if you have liver cirrhosis, you can get liver cancer. Paborito kong bargain ng patient yan. Pag sinabing ang tanging gamot lang po sa NAFLD is diet and exercise, gamot na lang, doc, matakot na lang tayo sa cancer. So I know it's hard. Personally, speaking from experience, it's hard to diet, it's hard to exercise. But if we think about our risk for liver cancer and other cancers, if we continue to be obese and overweight, then that in itself should motivate us to be more healthy. Kasi hindi lang ho pagiging obese at diabetic ang talagang risky for liver cancer. I came across a journal that lack of exercise or a sedentary lifestyle is also a risk factor to develop NAFLD, ergo increasing our risk for liver cancer. Avoid situations where you can get these blood-borne infections of the liver. Kasi nga po, yung binanggit ko kanina, Hep B, Hep C na chronic can predispose you to have liver cirrhosis, and liver cirrhosis can predispose you to liver cancer. But ang hepatitis B at C po in itself, kahit hindi pa po kayo cirrhotic, carcinogenic na po sila. So cancerous ho ang mga virus na ito. So what you can do is to protect yourself. If you have a partner or an exposure to Hep B, Hep C, get tested, get treated. Hindi po totoong hindi nagagamot ang Hep B. Nagagamot po ito, lalo na po ang Hep C. Pareho pong nagagamot ang mga sakit na yan. At ang purpose po ng paggamot sa chronic Hep B and chronic Hep C is to decrease your liver cancer risk. Okay? Goes without saying, alcohol is directly toxic to the liver. You damage your liver, cause liver cirrhosis, liver cancer. Hindi ko na po kailangan i-elaborate ang slide na ito. Stop smoking, not only for liver cancer, but for other cancers. Tobacco, tar, yung pong mga pangit na laman ng paninigarilyo, ng cigarette, smoke is a risk factor to develop cancers. Make no mistake about it, hindi lang ho sa liver, lahat ho ng cancer, at hindi lang ho lang, kasali rin ho ang liver. Smoking is also a risk factor to develop liver cancer. And limit your exposure to these chemicals. Kung mahilig kang kumain ng nuts, hindi naman sinasabi magkaka-liver cancer ka. Pero kung medyo spoiled na, medyo tagal nang nandyan sa lalagyan mo, or hindi mo na sure kung fresh ba itong mga kinakain mong corn and nut products, dispose of it. Because these aflatoxins found in this kind of foods can cause liver cancer. And yun nga, kung athlete ka, just train the right way. If you're a bodybuilder, train the right way. You don't need anabolic steroids because these are strongly associated with liver cancer as well. And know your family. Huwag na po tayong in denial. Huwag din naman tayong overkill sa pagtanong, ano ba talagang mga sakit sa pamilya? So, if you have diabetes in the family, if you have history of liver disease, other inherited or disorders, get yourself screened as early as possible. And advise your relatives also whom you think are at high risk. So know your family, know yourself. If you have risk factors, then get screened. Are there supplements that can prevent liver cancer and liver disease? Gaya ho ng sinabi ko kanina, wala po. Wala po. The only supplements that help improve liver function, so for those who have diagnosed NAFLD or drug-induced liver injury or even liver cirrhosis. So this is based on the American Association for the Study of the Liver and the Asian Pacific Association for the Study of the Liver guidelines. So mga guidelines na po ito ang nagsasabing talagang dalawa lang ang proven ng mga supplementation na nakakatulong sa ating atay kung may problema. And that is vitamin E and fish oil. I classify them under supplements because they're not therapeutic. Pandagdag lang po ito. Pero outright taking vitamin E is not gonna cure your fatty liver, same as with fish oil. Fish oil po, kung natukoy ng doktor na yung fatty liver is because of dyslipidemia o mataas ang cholesterol sa blood. Or if it's really part of your diet na talagang mahilig sa mamantika, mahilig sa fatty, and you want to take fish oil, but again, it should be guided by your doctor. I think these are the last few slides that I have. Kung maaari nating proteksyonan ng ating sarili laban sa cancer sa atay. Yes, we can do that. We can prevent liver cancer and other cancers. We just have to take good care of ourselves and our health and get screened as early as possible if it's indicated. So again, in behalf of the Olongapo City Medical Society, maraming salamat po sa inyong pakikinig. Prevention, prevention, prevention. Yan ho ang ating kailangang unahin because it is worth a pound of cancer cure. Maraming salamat po sa inyong lahat.
Thank you sa awareness.
So for that lecture, so marami tayong natutunan regarding the diagnosis, treatment, and prevention of liver cancer. So if you have any questions, pwede nyo po i-type in sa chat box po natin, no? Tapos pwede ibabasahin po namin, no? Tapos yung mga iba naman po na gustong personally sila po yung mag-ask ng questions, you can just raise your hand. So meron na tayong first question from Dr. Asian. What is an effective and safe treatment for pruritus in patients with chronic liver disease? So in general kasi sinabi niya chronic liver disease, not necessarily HCC.
Okay. Dr. Briones, yun pong chronic liver disease, para po sa kaalaman ng ating mga non-medical sa audience, yun po kasing mga tao o mga pasyente na may problema sa atay na matagal na. Maaari hong magkaroon ng katikate o pangangati ng katawan, pangangati ng balat. This is due to the problems of the liver, yung tinatawag po na bile acid, nagde-deposit po sa balat. Kapag po kasi may chronic liver disease, nagkakaroon ho ng ganitong komplikasyon. So what we usually do for this, Dr. Briones, is we can give ursodeoxycholic acid. No, yan pong gamot na yan, yung UDCA na tinatawag, that can help with yung cholestasis. Pag sinabi po kasing cholestasis, dahil may problema po sa atay, hindi po maganda o maayos yung circulation ng bile. Kaya nagde-deposit, pumupunta sa balat, nangangate. But most of the time, these patients with pruritus are also jaundiced or madilaw. We can give that po, Dr. UDCA. Sometimes antihistamines can also help kasi syempre these bile acids are irritants to the skin. So nagkakaroon ng some form of allergic dermatitis, kaya pumakate. So those are the things that we usually give, UDCA and antihistamines. Tama ba, Dr. Villareal? May nalimutan ba ako? Yes.
What particular, Dr. Manzo, na antihistamine na prefer mo, na ginagamit mo for your patients? Kasi marami tayong choices ngayon ng antihistamines.
Dati, maganda yung hydroxyzine kasi nakakaantok din. Kasi nga, itong pruritus, hindi sila makakatulog. But some patients are surprisingly still sleeping with the loratadine. So that should be enough. Loratadine or the desloratadine is okay. Sapat na po yun. Yun po kasing diphenhydramine, pwedeng maging balisa eh. Kaya I seldom give dipen oral.
Okay, so meron pang isang private na question. So good afternoon. Good afternoon, Doc. Uric acid trend supplements, is it okay ba? Hindi po ba siya makakasama sa liver? Tapos nagtitake siya currently ng fish oil, B-complex, vitamin C with zinc, Metalac, and D3. So yung uric acid trend supplements, ang contents are herbal. So agricus, turmeric, yucca, artichoke, tart cherry powder, milk thistle. Yun. So, milk thistle yung isa.
Milk thistle, actually po yan po yung silimarin. Oo, yung silimarin, silibin. proven naman po yan na nakakatulong. Some studies actually have shown that milk thistle is helpful. Doon po sa mga nabanggit nyo, ang medyo natatakot kami, dinamay ko na po si Dr. Villareal, yung agaricus, kasi mushroom yon. Ito po kasing mga mushrooms na to, pwede ho kasing may toxic content, so hindi tayo sure. Pero based dun sa mga nabanggit nyo, parang wala naman pong ibang nakakatakot. But it's good that you're reading your labels. Siguro po, wag na lang nating ituloy mga supplements na may lamang hindi tayo sure. Pero your fish oil is okay, your B complex is okay, your natalak, your malunggay is okay, and your D3 is okay. Yun na lang po siguro, hindi tayo sure dun sa ibang laman. Kaya po, kesa bigla na lang pong tumaas yung SGPT o yung ating creatinine, tinatawag, kasi hindi lang whole liver ang natatarget nitong mga herbal supplements na to, pwede rin sa kidneys. So siguro, wag na lang.
So we have nothing against alternative medicine, pero we consider
Nothing
it
against.
as herbal, so we're not sure of the effect. So,
Yes.
yun ang
No,
ano ni Doktora.
Yes. Opo, don't take us wrong. We're all for holistic treatment and alternative treatment. Pero if unsure, yun na lang po siguro yung dictum ng inyong mga friendly neighborhood gastroenterologist. If unsure, don't take. Ganun na lang para safe side.
So, another question is, the doctor gave me 200 milligram vitamin E to COVID. What is my liver sickness level? Can we determine that?
Siguro, mukhang ano naman po, hindi po yung mataas na dose yung binigay sa inyo, sir. Kadalasan po kasi kapag for NASH na tinatawag or kapag yung kombinasyon na ho ng fatty liver at maga, nagbibigay po ng high dose vitamin E ang mga gastroenterologist or hepatologist. Pero sa 200 milligrams po mukhang inaalalayan lang. Kaya hindi pa naman ganun ka, tingin ko, yung inyong liver sickness level. Pero siguro mas maganda po kung yan, mas regular po ang check-up.
Okay, so another question. Ito from Coach Shan. From Coach Shan Haskell. Is there a specific dietary program that is considered best for liver cancer patients? There's this current craze followed by many, including physicians locally and in the US, the ketogenic diet. What would you recommend?
There isn't really a hard and fast rule when it comes to diet for liver cancer patients, but it depends on the kind of liver function the patient has. Iba na po kasi ang usapan if this is a liver cancer patient with cirrhosis and cancer cachexia. Mas agresibo po ang ating pagbibigay ng nutrisyon sa mga ganitong cases. But if it's early stage cancer and it's the liver function is not decompensated o hindi naman po impaired ang function ng atay, I think normal healthy eating should suffice. Yung pong risk natin to make the liver disease worse, we just have to eat right. Personally, I don't know if Dr. Villareal will agree with me. I have encountered a few patients of mine who did the ketogenic diet. And I also did it myself. Kasi nga po, ang bilis makapagpapayat nito because it's using our fat stores as the main source of energy. Kaya lang po, if I may, although napakababa po ng level of evidence ng anecdotal o yung mga personal experience, pero ako po kasi mismo taking the ketogenic diet, pumayat po ako pero ang akin pong lipid profile o yung pong cholesterol level ko po sa dugo ay sobrang tumaas. And as we mentioned earlier, it should be a holistic approach. Not just losing weight, not just exercising, but to make sure that your blood sugar is at bay, your lipid profile is also normal. Yan, lahat po yan eh. We achieve the weight loss part with the ketogenic, but we increase our triglycerides and our LDLs, masama rin po yun for the liver. I have yet to find an actual statement from the societies, pero wala pong binabanggit pa ang APASL, ang ASLD regarding diet for liver patients, other than they are emphasizing the importance of right nutrition. Pero when it comes to yon, I personally do not recommend ketogenic for liver cancer patients.
Doktora, for ketogenic diet, di ba? Sometimes may mga cases din na nagkakaroon ng heart problem.
Yes.
May na-encounter ka
Oo,
na
meron
mga
din.
ganun?
Kasi kadalasan it goes hand in hand with the intermittent fasting. So, yun, yung hypoglycemia can trigger arrhythmia, yung mga, kasi matagal yung hindi kakain tapos may certain number of hours. So don't get me wrong, it's not bad because some people really do these things. But you have to make sure that you don't have other illnesses that can make that's contraindicated to these regimens. Kailangan po muna magpa-check at i-make sure po sa mga doktor ninyo na okay lang. Kasi hindi po ito pwede sa lahat. Yun, nabanggit pa ni doktor, may pwedeng mag-arrhythmia sa ketogenic.
Okay, so another question, Doktora, is liver cancer metastatic po? So tinatanong niya kung metastatic ba ang liver cancer or is there any other organs na pwede daw niyang ma-damage, na pwede niyang ma-involve?
Pwede po. Pwede. Hindi naman po agad-agad, pero gaya po ng lahat ng cancer sa katawan, may tendency po ang mga cancer cells na kumalat, mag-spread. Yan nga po yung tinatawag na distant metastasis or pag lumilipat po sa ibang organ. Kasi syempre po yung blood supply, lalo na po ang liver, kasi po yung tinatawag pong portal vein, yung isa ho sa part ng nagsusupply ng dugo sa atay, konektado ho yan sa buong katawan. It's a venous, lumalabas ho dyan yung dugo na galing sa puso, papunta ho sa ibang organs. So ano po ang implikasyon nitong sinasabi ko? Pwede ho yung tinatawag na hematogenous spread. So ang cancer ho ay galing sa atay o sa ibang organs, pero topic natin is the liver. Pwede ho siyang kumalat sa ibang areas sa ibang organs ng katawan. Kumpara po sa ibang cancer, mas mababa po ang tsansa ng metastasis sa liver. Kasi bago umabot po sa punto na ganon, kadalasan, hindi na ho kinakaya ng pasyente. Okay? Not because it's not spreading, it doesn't have a tendency to spread, pero bago pa ho magbigay ng pagkakataong kumalat, kadalasan sa liver cancer itself, maaring ikamatay na. Pero pwede po, pwede.
Okay, another question. So, nagkaroon ako ng hepatitis A dati. Tapos nagpa-check yung patient daw, mataas ang SGPT. Maaari ba daw siya magkaroon ng liver cancer?
Okay, iba po, mapapansin niyo po doon sa lecture natin, lagi pong bida lang si B at si C. Kasi po si A, ito po yung nakakasintomas tayo, kaya pakiramdam natin ito yung mas nakakatakot. Pero itong A po, gumagaling, hindi po siya nagtatagal ng matagal sa inyong atay. Pagka nagka-HEPA A, kahit na nagkasintomas ka pa, pag gumaling ka sa HEPA A, magaling ka na nun. Pwede kang ma-infect ulit kung hindi ka maingat, pero hindi siya namamahay sa atay ng matagal, unlike your B and your Hep C. So, hindi ka naman pwedeng magka-liver cancer sa hepatitis A. Pero, kung tumataas ang SGPT mo, na matagal na yung Hep A mo, baka may ibang cause. Yun ang kailangan bantayan. Kasi kung laging mataas yung SGPT mo at hindi nababantayan kung anong dahilan at hindi napapababa, doon ka pwedeng magka-liver cancer kung magkaka-liver cirrhosis ka. So, kailangan mo pa rin ipacheck. Wag po kayong matakot na pag mataas ang SGPT, SGOT, liver cancer na kaagad. Kailangan malaman yung dahilan kung bakit at kung mayroong magagawang paraan para mapababa, that eliminates your cancer risk naman. Kasi hindi naman basta-basta mangyayari yan kung hindi patuloy ang pinsala sa atay. Kaya nga po ang usapan natin is prevention, risk factors, para kung ano yung pwede nating magawa na hindi na siya lalala. So don't worry, pwede pa yan.
Ito, doktora, hindi na siya part ng liver cancer, no? Pero it's still hepatitis A. Anong difference ba ng A and B and C in terms of transmission?
Yes. Oo, natatakot lagi, di ba? Iwalay yung sa lahat po ng mga
yes, yung mga hinihiwala. Yun ang worry nila. Pag naninilaw,
Yes.
hihiwala yung mga utensils.
Yes. Ang unang-una, wag po tayong matakot sa lahat ng naninilaw. Kasi laging ganun ang naninilaw, hepatitis to. So maaari hong may ibang dahilan, hindi lang ho hepatitis ang sanhi ng paninilaw ng isang tao. Ang difference ho ng A, B, and C, ang A ho ay nakukuha sa contaminated food and drink. So siguro na yon, hopefully less ang chance ang magkaroon ng Hep A kasi sa bahay tayo lahat, yung mga more of take out, hindi tayo kumakain sa labas. But if you have an exposure to a Hep A person, infected person, you drink their drink, you use their straw, you use their utensils, doon ho pwede. Kasi fecal oral po, laway at dumi ang transmission po ng Hep A. Ang Hep B, sa dugo po talaga. Ang B and C, pareho pong sa dugo. Lahat po sila virus, lahat po sila nakakahawa, pero ang B and C po, kumpara sa A, sa dugo lang po nahahawa. Yung nabanggit natin sa lecture. Yun, kasi sa sexual intercourse, sintabi po kung may mga bata sa audience, explain nyo na lang. Dapat wala. Okay. Kasi syempre there's trauma with sexual intercourse. So that's a portal for infection, a route for transmission. IV drug needles, yan. Sharing of needles sa mga IV drug users. Yan ho ang pwedeng pagmulan. Kaya po actually B and C are considered sexually transmitted diseases. Doon ho sila nahahawa, bloodborne. So kung may Hep B and Hep C na positive naman, hindi naman po yan nahahawa sa laway at sa dumi. Sa dugo po talaga. But since household contacts nga, yung frequency ng contact sama-sama, hindi naman po kailangan ihiwalay ang kubyertos, but it's best to get all household contacts vaccinated against Hep B if one family member is Hep B positive. Kasi po ang Hep may bakuna. Actually, Hep A may bakuna din naman.
Okay. So in relation to Hep B, Doktora, no? So pag infected ba ng hepatitis B, so prone siya magkaroon ng liver cancer in the long run, no? So can we prevent this? Meron
Na
ba tayong
magka-liver
means
cancer.
para magkaroon siya ng liver
Oo.
cancer?
Yes, pwede. Kailangan po nating alamin yung status, yung level po ng infection sa dugo. Kasi karamihan pa rin po ng Hep B patients natin o mga hepatitis B patients ay yung tinatawag na inactive carrier. So natutulog yung virus, nasa katawan, nasa atay, pero kasalukuyan siyang tulog. Pero in relation po sa ating topic, kung mataas ang SGPT at napatunayan na may Hepa B, dito papasok yung sinasabi mo, Doc, na kailangan nating prevent ang liver cancer. Mas agresibo tayo sa mga taong ito. And we can do that with treatment. Kasi nga po, ang hepatitis B nagagamot. So, swerte nga po ang mga pasyente natin na Hep B na yon kasi affordable na po ang mga antivirals for hepatitis B. So, ito pong mga antivirals ang solusyon para ma-lessen ang risk for liver cancer ng ating Hep B patients. Pero wag po rin matatakot naman. Kung normal ang SGPT mo, normal ang liver mo, bata ka pa, nasa 20s, 30s, at sinabi ng doktor, tahimik yung virus, inactive carrier ka, huwag ka naman ma-excite, bigyan mo na ako ng antiviral para hindi ako magka-liver cancer. There is an indication, a criteria that we follow, pero oras po na sinabi ng doktor, kung kailangan mo ng mag-antiviral. Ibig sabihin, pinapangalagaan po kayong magka-risk for liver cancer, kaya sundin po natin.
So it's important yung monitoring. So, pag sinabihan kayo na papaulit yung labs, meron pong reason yun.
May reason po yun. Kadalasan po, para sa impormasyon ng nakararami ng lahat, pag hepatitis B or hepatitis C patient po, mas agresibo kami. Mas madalas po ang monitoring. So yung SGPT yan, every 3 to 6 months. Kami po ni Dr. Villareal, pag tumuntong na ho ng 40 at mga lalaki, every 3 months na ho ang SGPT. Kasi nga, aware ka na, liver cancer risk ito. So, di baling OA. Kasi pag nahuli ho ng maaga, nagamot ng maaga, better survival.
Meron pong follow-up babies. So, does that mean po ba, Doc, kapag po nagkaroon before ng hepatitis B, tapos gumaling ka na po, ibig sabihin po ba silent carrier ka po? O baka ibig sabihin niya dito is previously diagnosed ng B. I think B yung sinasabi niya. Tapos gumaling siya.
Swerte naman niya.
Kaya nga eh.
Dumating.
Then silent carrier. O, parang ganun yung tanong ni ano, Ting Ma'am, if ever baka ganun.
Sige. Yun po kasing, ang hepatitis B, yes, it can be treated, it can be controlled, but it has yet to be discovered yung gamot po na talagang lalabas po sa blood test na non-reactive ka na. Kaya po pag nag-start po ng gamutan for Hep B, ito po ay gamutan na habang buhay. Kasi po, you will always need it. Studies have shown that if you discontinue it, the viral load will go back up, the SGPT will go back up, and your cancer risk will go back up. So once your doctor tells you that you have to start it, you have to take it for life na. Kailangan pa ho nating, sana nga dumating po sa punto na gagaling sa hepatitis B. Maaari pong maging tahimik, makikita ho dun sa testing ng virus sa dugo na it's not detected, baka yun po ang ibig niyong sabihin. If it's not detectable, nakita po sa viral load na halos walang makitang virus, pero hepatitis B patient po kayo, opo, kayo pa rin po ay carrier. Pwede pa rin po kayong makahawa, but to a lesser degree. Kumpara dun sa mga taong talagang mataas ang viral load, mas mataas po ang chance ang makahawa sila. So, I think I hope I answered the question. Tama ba? Yun ba yung tanong?
Yes.
Okay.
Oo. Yung question niya kasi, kung nag-treat siya, ay gumaling siya, then parang silent carrier pa rin ba siya?
Opo.
Then yung answer.
Yes.
Another question is, hepatitis A po ba kapag nahawa yung buntis, masama po ba sa baby?
Hepatitis
This is
A.
viral A.
Yung Hep A, pregnant patient na Hep A.
On a pregnant patient, makaka-affect ba dun sa baby?
Pag ipinanganak po yung bata, hindi naman po kasi ang Hep A po ay fecal oral route yan eh. Pero pwede pong mahawa si baby kapag nailabas mo na, pag pinapa-breastfeed mo na, syempre, pwede. In that way. Pero yung manganganak ka na Hep A ka at manganganak kang Hep A ka, hindi mo naman yun maisasalin. Kasi nga ang Hep A is fecal oral po ang transmission sa laway at sa dumi.
And what about the mommy? Kung meron siyang Hep A,
anong gagawin?
Yung magiging effect sa kanya?
Wala. Gagaling ka niya. Oo. Hep A is,
Kasi baka yun yung concern niya. Kasi
ayun ba
meron
yung
siyang
concern
hepatitis
niya?
A.
Sorry.
Well, probably that's one of her concerns.
Yes. It's
in her baby.
Yes. Hepatitis A is self-limiting. No, igagaling ka dyan. Meron lang talagang mga minsan na yung tinatawag na fulminant hepatitis na medyo yun. Kailangan i-admit, kailangan alalayan. Pero maliit lang ng porsyento na nagkaka-Hep A yung ganun. Kaya kadalasan naman sa hepatitis A, kusang gagaling, kakayanin ng katawan mo, ng atay mo, gumaling sa Hep A. So don't worry.
Okay. Doktora, ang oral contraceptive pills ba pwede mag-cause ng liver cancer?
Liver cancer, oral contraceptives.
OCP.
Meron pong isang klaseng bukol sa atay na pwede hong at risk ang mga babaeng nag-oral contraception. But good news is, hindi naman po ito cancer. But you can have a tumor in the liver, a benign tumor in the liver that's related to oral contraception. Hindi naman po liver cancer ang kinakatakot sa oral contraception, kundi iba pong side effects. So, thrombus, yan, mga ibang delikadong effect. But when it comes to cancer of the liver, hindi naman. Unless may bagong journal.
Not all liver cancers liver masses are cancer. So it has to be investigated.
It has to be investigated kasi itong focal nodular hyperplasia na tinatawag, yung FNH, yan yung related sa mga babaeng nagko-contraception. Benign naman yun. Yes.
Ito, another question from Teacher Babes, follow-up ng hepatitis B. So, vaccination naman, ang question niya. Kapag pag na-vaccinate ang babies, Hepa B vaccination ng babies, how long ang protection daw nito?
Opo, kailangan po
And
yan.
how do we check it?
Yes, it has to be updated. Diba, for newborns, we give it at 0, 1, and 6. Tapos, school age, mabibigay ulit. Ang sapat na po actually yun at school age, and then when they grow up to be adults, we just assess if they have risk factors na pwede silang mahawa. Yan, nung ako po medtech, kasama ho yan si chine-check. Kasi di ba, nag-draw kami ng blood, may exposure sa healthcare. Nung mag-med din tayo, di ba, pa meron din check ng Hep B. Depende ho sa level ng titer. So, kailangan hong ma-check yung tinatawag na anti-HBs titer. At kapag mataas na ho yung titer, hindi na ho kailangan ng booster. Pero pagka laki ho ni baby at school age, definitely mabubooster po siya. And then, pag naging adult na siya, depende sa kanya, pwede po siyang magpa-booster kung mababa pa po yung titer.
Okay, there's a question. Doc Arl, peanut butter is bad for liver?
Sarap nun eh. Parang, hindi naman. Nakakatakot lang po talaga kasi nga yung aflatoxin. No? So siguro, kasi po I was able to read an isolated report na meron hong mga ibang distributor supplier na yung mga lumang peanuts po yung ginagamit tapos naglalagay na lang ng additives or preservatives para maging okay. Yun po ang nakakatakot kasi kung lumang peanuts ho ang nire-reuse for peanut butter para kumita, yun ho ang pwedeng may aflatoxin. Pero kung trusted naman na brands, ano naman, okay lang naman. And then you just have to moderate your peanut butter intake kasi maasukal, ma-fat, so hindi healthy, pero masarap talaga pag hindi healthy. So, yun po ang precaution natin. Huwag naman po kayong matakot sa peanuts and corn
Yes.
products kasi hindi naman
Baka
lahat
matakot na sila mag-peanut butter because of that.
hindi na sila kakain ng adobong mani.
So hindi
Sarap
naman. Yung stale,
Opo.
sira.
Yes, stale. Mm-mm. Tsaka yung ano, kung saan nabili. Yung mga 10 years nang nasa pantry may peanut butter. Tapos mo na yun.
Follow-up question for the vaccine. At what age po dapat mag-take ng booster? This is for Hep B. Is there a certain age or do it depend on the anti-HBs
Yun
titer?
po, as I mentioned, after you get it in childhood and then yung school age po, bibigyan talaga lahat ng bata. Kasama po ito dun sa expanded program of immunization. Pero upon adulthood, that is the discretion na po ng adults yun. You can get a booster if your anti-HBs titer is still low. If it's high enough to protect you, you don't need it. Pero halimbawa, nakaka-encounter po kami ni doktor ng mga pasyente, di ba pa na ang husband happy positive kahit mataas ang titer, gusto niya pa rin magpa-booster. Okay lang 'yun. You just have to be guided by your doctor. Pero yun po, wala po talagang fixed recommendation sa adults. It depends on the need of the adult if kailangan ho ng booster or hindi. Paminsan po, yung mga cirrhotic naming pasyente ni doktor, so nagbibigay po kami ng booster ng B and A kasi ayaw na natin magdagdag ng problema pa sa isang cirrhotic. So ito po ang isang indikasyon ng booster doses in adults.
Okay, another question from Mr. Danny Cabling. Mararamdaman po ba, Doc, pag ang liver ng isang tao ay in bad shape, will there be any pain in the liver area? Kasi commonly masakit daw, right? Upper quadrant, then sabihin nila may liver problem na. Kung magpapa-ultrasound makikita fatty liver.
Yes.
So, will fatty liver explain the pain?
Opo. In a way, okay na din. Kasi dahil nagpa-ultrasound, nakita fatty. Pero kasi hindi po kaya po na nabanggit ko, fatty liver is asymptomatic. Kapag po nagkakaroon ng pananakit sa kanang bahagi ng tiyan na nagko-correspond sa lokasyon ng atay, maaari hong may ibang dahilan ito na kailangan hong alamin. Liver tests or blood tests would not probably suffice in these cases. Diyan ho papasok yung napag-usapan natin kanina na imaging tests. So other organs can be in that area as well. Typically, ang sumasakit ho dyan sa kanang bahagi, kung hindi ho problema sa sikmura, pwede hong abdo. Pero don't worry, fatty liver will not cause pain in the liver area that we call. There could be other problems. Pero kung nag-fatty liver po na nakita at normal ho yung ultrasound pero masakit pa rin yung tagiliran, may iba pong dahilan.
Okay, so fatty liver will not cause pain.
Yes, fatty liver will not cause pain. Period. Yes.
Okay, mukhang wala na tayong question.
Opo. You're welcome. Take a seat.
Ako na lang, last question na lang.
Sige.
For a patient with history, family history ng liver cirrhosis, are they at risk of having liver cirrhosis? Regardless ng cause niya.
Ang conflicting yung data. Merong nagsasabi na hindi daw related, pero may nagsasabi na related. But if we base it on what we see in our patients, it does happen that if there's a family history of liver cirrhosis, regardless of cause, 1 or 2 of the children or relatives can also have liver cirrhosis. Kaya pwede pong may genetic component. Pwedeng, kasi yung pong isang cause ng cirrhosis, yung tinatawag nating cryptogenic. Pag sinabi pong cryptogenic, sinuyod na ni Doc pero walang makitang dahilan, cirrhotic ka lang talaga. Ito pong mga cryptogenic cirrhosis ang nakita po ng mga pag-aaral na pwede hong namamana. So, kailangan pa rin pong i-work up. The screening will still be the same for a high-risk individual if you have a family history of liver cirrhosis. Tingin ko po on the safe side, Doc, screen na rin natin as high risk.
Is there a way na to prevent pa or is there may guidelines na ba tayo na how to screen these patients or wala pa?
Ang sabi lang ni HSP, ang guidelines natin for screening for liver cancer. So yung kung liver disease na screening for liver disease, discretion na po ng doktor yan kung kinakailangan. But based on the clinical practice guidelines ng HSP sa screening ng liver cancer is ultrasound of the liver twice a year with or without alpha-fetoprotein. Kung may high risk siguro or family history ng liver cirrhosis, pwede natin idagdag yung tumor marker. Kasi nangyayari po minsan na hindi nahahagip yung bukol sa ultrasound. Baka matakot naman sila. Minsan lang yun nangyayari. So, pagka ganon, depende sa discretion ng doctor, we can request for a tumor marker and an ultrasound at the same time to screen for liver cancer.
And speaking about nung tumor marker, so we mentioned alpha-fetoprotein, no? So minsan makikita natin may alpha-fetoprotein na, may ultrasound na. Ano ba yung significance ni alpha-fetoprotein? Kasi sometimes makikita ng mga patients, medyo po mataas ng konti yung alpha-fetoprotein ko based on dun sa normal range. Liver cancer na po ba ako?
Yes, gandang tanong po yan dahil yung may mga tao po talaga na nagpapa-request ng mga tumor markers on their own. Nagpapa-CEA, yung mga CA19-9, nagpapagawa on their own. Lagi po itong dapat discretion ng doktor because these tests are subject for interpretation parati. Kapag po may liver cirrhosis, minsan nga po kahit fatty liver lang, tumaas yung SCP, ay yung alpha-fetoprotein ng bahagya. Sa mga pasyente po namin na may binabantayan tayong sakit sa atay na high risk for liver cancer, yun pong bigla ang pagtaas ng alpha-fetoprotein from the baseline is an indication for us to be more to be more careful but to look for the possible cause of it. Yun po ang mahalaga sa alpha-fetoprotein. Meron po tayong sinusunod na level when it comes to diagnosis of liver cancer. Kung kapag ang level ho, ayan, mahigit 100, mahigit 200, mahigit 500. Diyan ho yan, alam na natin na liver cancer. Pero pag mga 5 or 10, ipa-explain nyo po sa doktor kung bakit siya mataas. Kasi hindi ho siya dapat mataas, pero may dahilan po kung bakit. But the significant level of elevation tells us that this is indeed liver cancer.
So it's best na ma-evaluate pa rin ng doktor, no?
Yes.
Hindi si Google.
Hindi si Google. Hindi si Google.
Okay, last question na from Rog. Doc, anong food ang marerecommend nyo po sa may mga liver cirrhosis? Is there a certain diet ba or any supplements na pwedeng ibigay kung cirrhotic ng pasyente?
Pagka liver cirrhosis na po kasi, iba na pong usapan. Kailangan po nating matiyak kung ano hong level ng pagkasira ng atay. Kasi pwedeng early cirrhosis eh. Pag early cirrhosis yan, kung anong normal na diet, same. Basta healthy. Pero pag decompensated na tinatawag o medyo hindi na kinakaya ng katawan yung pagkasira ng atay, mas maagap na po tayo sa nutrisyon. Low salt po ang unang-una naming pinapayo kasi po itong mga cirrhotic na pasyente prone hong magmanas or manas na. Kaya kailangan ho yung asin ay mababa tsaka yung magandang klase ng protina. Kasi yung protein synthesis, di ba? Na-discuss natin, function ng liver is protein synthesis. So these patients with liver cirrhosis, they need an added dose of protein in the diet. Kailangan din ho nating bantayan na bumaksak ang asukal kasi part po ng pagkasira ng atay or liver failure, nagkakaroon po ng hypoglycemia. Kaya nag-a-advise po kami ng mga gastroenterologist at hepatologist to have snacking at midnight. So have to have snacks at night, kumain ng additional or yung mga nutritional supplements po na dinadagdag, enteral supplements para madagdagan ang nutrisyon kasi talaga pong namamayat ang mga may cirrhosis. Again, this is per advice of your doctor. Huwag po si Google kasi si Google iba ang payo. Iba rin ang payo ng inyong friendly neighborhood gastroenterologists.
Okay, I think that's the last question na, Doktora.
Oo nga.
Mukhang na-cover
Tsaka 6
naman natin lahat. Yes, by 6 o'clock na. So before we end this session, no, may I ask again, Mr. President,
Hello, yes, good afternoon.
you would
again.
like to present
And again, thank you. Before anything else, hindi ako biased dahil sa speaker natin, pero I think everyone will agree na we were enlightened very much with liver diseases. I would just like to share my screen again to present our certificate of appreciation to Dra Arl Ann Manzo for her valuable contribution as resource speaker for her lecture entitled Tamang Pagbabantay sa Aking Atay during the celebration of liver cancer awareness as part of the Society's Cancer Advocacy Lecture Series, given this 29th of January in the year of our Lord 2022, signed by yours truly and Dr. Paolo Villareal as the Chair of Liver Cancer Awareness. Likewise, this certificate is presented to Dr. Paolo Villareal for his contribution as moderator during the lecture entitled Tamang Pagbabantay sa Aking Atay, given this 29th of January in the year of our Lord 2022, signed by yours truly and our speaker as the Secretary of OCMS. Again, thank you, Dr. Manzo and Dr. Villareal. So to close, may I call on our Vice President, Dr. Jerome Michael Acosta.
Hello. Hello. Yan. Magandang hapon po sa lahat. Thank you po, Dr. Arl at Dr. Pau for a very informative lecture. It's very timely kasi marami sa atin ngayon umiinom kahit actually yung liver po kasi that's actually very dear to me kasi when I was diagnosed with amoebiasis nung 2011, I was also na-diagnose ako with may parang hemangioma, cavernous hemangioma sa liver, and I was actually advised to not to drink much, no? By Ate Arl and yung GI ko nung na-admit ako sa UST, and true enough, talagang hindi na ako nainom after that. Yun nga lang, like yung dinascuss ni Dr. Arl kanina, the alcohol dehydrogenase, it really goes down pag hindi mo ginagamit. Kaya madali na po akong nalalasing. Opo. And it doesn't mean na, tama yung kanina na sinabi ni Dr. Arl na hindi basihan ang mga nalalasing sa risk, correlating with the risk of liver cancer, because maaaring hindi ka nalalasing but umiinom ka ng marami compared to dun sa nalalasing with just a bottle or two. Kaya you're more at risk with liver actually. Yan ang 'di ba? Yan ang pumatay kay ex-President Cory Aquino. So and once na nag-jaundice and everything, it might be too late. So it's important to have your liver tested. Usually may mga blood chem promos naman tayo sa ating mga respected laboratories. You can have yourself tested like once a year tulad ng advice nila doc para mabantayan lang ang liver, no? At ayun lang po, napaka-informative at talagang marami tayong nakuha sa lecture for today. At salamat po sa binahagi niyong oras, no, Doktora at Doc Pao. At bago po tayo umalis, pwede po